Alrighty, hello everyone, and welcome to SCO's April webinar on our externship program. Thank you so much for those who are rejoining after our rescheduling, and for those who are fresh to this webinar. We're so glad to have you. Thank you so much for joining us. I hope you all are staying safe and healthy. My name is Avery Cunningham. I am a Student Services and Admissions Officer here at SCO. I am one of the admissions team members who answers your admissions questions and participates in the admissions process. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We'll have time for questions towards the end of the webinar, but in the meantime, if you do have any questions or concerns that need immediate attention, please use your chat feature at the bottom of your screen to communicate with us. Today, you will be hearing from Dr. Cheryl Mengelt, our Director of Externship and Residency Programs, about specifically the externship program, one of the real jewels in SCO's curriculum and our experiential learning crown. From how sites are chosen to how students select their experiences, it's sure to be a wonderfully informative and educational webinar to give you all even more insight into what your education could look like and what your future could look like here at SCO. This webinar is being recorded and will be free and available to view starting next week on our website. And with that, I turn it over to Dr. Mengelt.
Thank you very much. Hopefully you all can hear me. As Avery mentioned, I am Dr. Cheryl Mengelt. I am the director of both our externship and our residency programs. I have been specifically leading externships since 2011, so I've been doing this for a number of years. Pretty well versed in the experience. Hopefully you were all able to stop outside our department on your tours through campus to see that we have an extenuating list of SCO externship options for your selection. I know that you've got a lot of burning questions. It seems so very far off, but believe it or not, you will be selecting and completing your externships in the blink of an eye. Go ahead and advance the slide, please. So our externship program mission is to expand the educational and clinical experience of Southern College of Optometry students in order to provide larger numbers of patients, exposure to off-campus healthcare settings, offer complex cases to increase your efficiency, your patient care experience, your confidence in treating patients in a variety of settings all over the country and in Canada. Next slide, please. So the externship rotations will take place in the fourth year of your curriculum. You will spend roughly 16 weeks on campus in our specialty clinics, and then 2/3 of your final year in the SCO curriculum will be at two separate externship sites. One of those will be a private practice rotation, in which you will learn not only the skills to best serve your patients, but you will also be afforded opportunities to learn private practice management. And your second rotation will be in an institutional site, again, about the same length of time. And that is set up for a high volume of complex and advanced clinical cases that you will be, so that you will get experience with that dynamic as well. Next slide. So SCO currently offers private practice rotations in the United States and Canada. About 33 states are represented in our current site offerings. With that said, we do look at incoming student census in order to best set up for each individual class an appropriate number of extern sites in an adequate number of locations for those students. So the current site list for the class that's about to graduate for the class of 2025 will look a bit different. The site list is very fluid from year to year so that we can best equip those who would like to go practice back in their home states, as well as those who would like an adventure and would like to get opportunities elsewhere. We also have a variety of institutional sites, so think VA hospitals, hospital-based programs, co-management centers, and currently we have over 30 states represented for that site design. All sites have been vetted by myself and have been personally or will be personally visited prior to any student stepping foot in that practice to make sure that they are able to deliver the educational experience that we require of our sites. And then periodically thereafter, we will visit if there's been any substantive change in preceptor, change in ownership of a practice, change in even just the building and the physical settings. We will go back again and make sure that these sites are well equipped to deliver an exceptional educational experience for our students at Southern College of Optometry. Next slide. So again, I mentioned that we have two different site types that will both be experienced in addition to our on-campus fourth-year rotation. So examples of institutional sites are government facilities such as military bases, VA hospitals, Indian health centers. Think about co-management centers, community health centers. We do have children hospital settings that are devoted specifically for care from infant to the age of 18. With these sites, there is an expectation that they will offer our students greater clinical independence, a higher volume of patients to see, complex ocular disease cases that you may not necessarily experience, treat firsthand in a private practice setting, surgical co-management centers where you'll be doing preoperative and postoperative care for patients in those settings, multidisciplinary settings, and in general, these are going to have a higher intensive academic rigor to offer to our student body. Private sites, on the other hand, are doctor of optometry operated. They have a broad range of optometry primary care and advanced services. There are a number of our private sites in states that offer laser, in which our students are getting hands-on laser experience for our students. So I don't mean to suggest that all private sites will be primary care in nature. But the idea for these private sites, SCO is still the only optometric institution that requires a private practice rotation. And for that reason, we feel that it is imperative that our students learn how to manage practices and learn from those doctors who are running private practices well, very experienced, very successful, so that they can take some of the mystery out of the ownership and business portion of what is entailed with a career in optometry. You will learn long-term doctor-patient relationships, etiquettes, techniques for garnering new patients and maintaining those relationships through the years. You will see doctors who are involved in community involvement, that are involved in advocacy at the local, state, and national level. And again, hopefully we'll learn business management best practices in those environments. Next slide, please. So what are we looking for when we look for our preceptors? And essentially your primary preceptor is the optometrist at whatever site design that is charged with leading and facilitating your education. So they are vetted to be the best of the best in the eye care world. They will be garnered or afforded an SCO adjunct faculty appointment. So they have the rights and privileges as the same faculty that will educate you throughout throughout your entire term on campus. They are teachers, mentors, supervisors. They should be role models, and they should be adept at evaluating student skills so that they know exactly where to take your education when you arrive, and what you need to know and bring you to a level that a graduate of optometry needs to acquire. They will practice at the fullest scope allowed by their states. They are also volunteers in their communities and, again, national, local, state levels. We look for members who understand the importance of optometric organizations and why that is important, and can instill and give you the guidance in that regard for why it would be beneficial to you as a practitioner in whatever modality that looks like to be involved in those organizations and how they can help facilitate your success. They are advocates and advancers of the profession. So these are the doctors that are lobbying for scope expansion, that can teach you how to lobby, show you by demonstration how to make optometry the best that it can be in the state in which you would like to practice. And of course, they're licensed healthcare providers. Their licenses are in good standing. And though those are at minimum the things that we look for when we onboard a new site and a new preceptor at that site. Next slide, please. So how does this apply? When, where, how does this look for students at the Southern College of Optometry? We work very hard to continue to vet sites, onboard sites, and even remove sites at the request of a preceptor for maybe personal situations, or because they just don't, their model is not the best fit when we put a site in practice. So as I mentioned, those sites are pretty fluid from year to year, but we will finalize your site selection list in the summer of your third professional year. So you should know by August of that third year where you are going to spend the entirety of your fourth year rotations. So almost 9 months in advance for most of the student body. How do we make those assignments? They are based on your student's home of record. So that home of record is what you have placed on your application to SCO. So if you are from Virginia and that's what is on your application, then that will be considered your home state of record when it comes time for site priority. Now, using that as an example, if you are from Virginia, then you will have priority for all the sites that we may have available in the state of Virginia, both in a private practice and an institutional rotation. We do that on the assumption that if you are from Virginia, you may like to be able to network with doctors in Virginia, understand how actually practicing optometry in Virginia looks firsthand. And we'd like to give you that option if that's something that you would like to pursue. You are of no obligation to go back to your home state. As I mentioned, if you decide that a site in California better suits your needs. We do use class rank. So my advice to you from day one in any regard is to put your best foot forward, to have a competitive GPA. So that when it comes time, you will move up in a higher tier for selecting the sites that hold your interest. We do look at conflict of interest, so no students will be able to rotate with a family member who may be an existing externship preceptor for us. You will always be a child before you are a colleague of a parent. So in general, there are other considerations for conflict of interest, but all of those are in regard to you getting the best possible educational experience and fair experience that you can when you are out rotating through these sites. You do have to be a U.S. citizen to rotate at a government facility. But we have lots of institutional sites that are not government facilities for those students that might fall into that criteria. And we do offer Canadian sites, but you do have to be a Canadian resident to rotate through those sites. Next slide, please. So there are a number of ways that can help if you just have absolutely no idea where you might want to rotate or what experience you're looking for. We do offer each student who rotates through a site is required to do a detailed site summary. We ask that at minimum, students provide feedback on the 3 highest pros for that site and 3 negatives for that site. Sometimes those categories are difficult to come by, but we do ask students to really reflect deeply on their experience for the benefit of those students coming up in next classes will have a good idea of what to experience. So for instance, is it a very demanding site? What is the personality of the doctor? Does this site offer a lot of contact lens exposure, but maybe no pediatric exposure? So those are the things that you would utilize site summaries for, just to get a glimpse of past student experience. We also make my reports, or another faculty member who may visit a site on my behalf. We write detailed reports, and it essentially is considerations for the day in a life of an extern student. So you'll have those at your disposal. You will also have a very lengthy site application that each site is required to populate and send to us. And then, of course, I will be a good resource for you. I will set up at your request individual counseling sessions to better understand you, what you're looking for, your learning style, your personality, to counsel you on what might be the better fits when you're going through that selection process. Bottom line is, I want your 4th year of optometry to be the best, most satisfying, rewarding year. And so we will do everything we can on the front end to ensure that once you set foot in those sites, that it is a very rewarding process and experience for you. Next slide, please. So here are just some snapshots, some examples of some different ocular conditions that you will see. So hopefully at this point, nobody is under the impression that optometry is a career of which is better, 1 or 2. That certainly is a core component of what we do as optometrists. But we also do a wide variety of low vision, ocular disease, ocular surgeries, co-management. And so these are just some of the snapshots that students have sent to us from prior rotations. Next slide, please. So that we don't completely lose touch with you when you're across the country for 16 weeks at a time, or essentially 32 weeks of the year, we will have some externship department assignments that you will do for us, so that we can keep eyes and ears and understand what types of exciting cases you're managing, what experiences you're having. You will do SOAP cases and expanded cases. You'll do some practice management assignments. And of course, we'll get more into that as you get closer to the time. And some of those requirements may shift and change as we evolve as a department. And again, making sure that your experience is at a very high level, an applicable level. Some sites do require you to give to take part in journal clubs and give case presentations beyond what our office requires. And those are in an effort to shape you and form you into the next leaders and presenters of our profession. Next slide, please. So housing is always a little bit tricky, but you are not the first students to go out and pave the way for externships. So we do, again, ask students who have been at your sites in the past to let us know what options they considered, why they chose the housing that they did. And hopefully that will be of great benefit for you when you're looking for options for short-term leasing, whether those are furnished, not furnished, in locations that are certainly safe, and in areas where you can enjoy your environment. We want you to get the most out of your educational experience, but we want you to have fun at the same time, and reap the rewards of 16 weeks in Southern California, if that's where you decide that you would like to go. You are responsible for securing housing, but we're not going to just throw you to the wolves. We'll give you some guidance. Your preceptors and current students that are at those sites can be good resources. If I have any resources available, I'm happy to share those. But bottom line, you are ultimately going to be responsible for housing options. So knowing that, you're going to want to keep your budget in mind. You're going to want to operate in decisions that make the most sense for you, not only from an educational perspective, but from a financial perspective. And certainly you're encouraged to take advantage of family members and free housing that might be available with, friends and family in those particular areas. Do understand when you're signing leases that 2/3 of the class will be away from campus in the summer term. And so that can make leases, 12-month leases, a little tricky in your fourth year. So once you know where you're going and you're settled, again, for most students, that's going to be, you're going to have a 9-month window before you have to make living arrangements for that fourth year. Just keep in mind, and we can help you get out of leases if that's something that we need to do. But just want to give you a heads up. Again, that 32 weeks of your fourth year will, for the most part, be spent away from Memphis and SCO. That said, for those students who ideally want to remain in Memphis for a year, for spouses that are working, for children that may be enrolled in school, or just because you want to spend the year here in Memphis without the hassle of moving, we do have an ample amount of local sites from which to choose. All right, next slide, please. So we consider your externship rotations the icing on the cake, right? You get a wonderful educational foundation in the classroom and in the laboratory and in the students that you will see, or excuse me, in the patients that you will see over in the eye center. You will take all of that knowledge, all of those skills, and really put it into practice and ramp up when you are out in the quote unquote real world of optometry. We will work with class officers. We will give you tips to work together as classmates so that the majority of the students are ultimately satisfied with where you go. You may not always get your number one choice of site, but I can guarantee that you are going to have an exceptional fourth year no matter where you land. So go in with an open mind. And as with anything, you will get out what you put in to your rotations. And we'll talk a little bit more as a class and some strategies for working together, working with us, so that you are satisfied with where you land in that fourth year. It's an exciting time. And I really like to go into it maintaining that excitement and keep as much stress out of the process as possible. And then the only thing left to do at that point is to graduate. And believe it or not, you haven't stepped foot one into your first day, and that time will come in the blink of an eye. Next slide, please. So again, I'm Dr. Mengelt. I am available for questions via email. For anyone that would like to ask a very specific to you question. My office is on the 10th floor of the tower. So when you get a free moment, please stop in, introduce yourself, let me know where you're from. The better I know you, the better, again, I can help facilitate these rotations when the time comes. And with that, thank you for joining us live. I hope this information is of benefit to those who are joining us now, who may listen in the future to the recorded presentation. And I would also like to apologize and thank you for taking advantage of rejoining us. I was just very ill the last time and had to cancel, and I apologize for any inconvenience that may have posed. And with that said, that was sort of a quick overview. If there are any questions, I would be more than happy to address those here.
Yes, wonderful. Thank you. So yes, for anyone who does have any questions that they'd like to share, currently feel free to use either the chat feature or the Q&A feature. We'll be able to see your questions in either of those forums. Very good. And then while we're waiting for those, since Dr. Mengelt, we may have some people on this webinar, and then certainly those who watch the recording in the future who are prospective students who may just be beginning kind of their process of applying for optometry school. When looking at externship programs and trying to kind of plan out their next 4 years of schooling, any recommendations for things that students should be looking for, aware of, kind of planning for, even before they apply for optometry school when it comes to externships?
Yeah, so I think just deciding to apply to optometry is obviously a vital first step. I think when choosing optometric institutions, I would see what externship sites look like, where they're located, when they're determined, to help you, just sort of best decide what school might be the best fit for you. I would use the opportunity throughout the optometric curriculum to decide what type of optometry really speaks to you. Are your courses in pediatrics, for example, are those the courses that you particularly enjoy? Are those the courses that maybe you say, children aren't for me? I really enjoy my geriatric courses, and use that optometric experience to help pave the path to externships so that we can best align your experience with and how and where you would like to practice optometry. So those are the things that I sort of would look for. Now, understand that even though everybody's externship rotation will look different, there are some commonalities. We don't want anybody to go a full year without seeing a single glaucoma patient, for example. But if your interest, again, is in low vision or vision therapy, we do offer sites that might be heavier in those disciplines while still creating a well-rounded experience for you. So those are the things that I would look for. Where are the sites located? How can I best prepare and align myself so that I secure the sites that I would like? And then how do I make the most out of those rotations while I'm in those rotations? So I think, determining externship rotations is every bit as important once you're admitted to optometry school as deciding on optometry in the first place. So hopefully that answers that question.
Yes, it does, certainly. Thank you. I don't see any questions in the chat. Again, if anyone does have any questions, feel free to post them here, or as Dr. Mingel said, feel free to reach out to her personally for any more specific questions. Um,
Yeah, don't
Very
be
well.
afraid. Yeah, don't be afraid to reach out. I, I have every student situation is different, but chances are I've encountered something similar along the way as I've been the director in this position. So if you have any questions that might be instrumental to you in the externship realm for even thinking about if whether SCO was the place for you or not, please at any time feel free to email those questions that you maybe aren't comfortable answering in a group setting. Um, the question I get a lot is I'm from a little town in North Carolina, and I don't see any sites in the regional area that are externship sites currently. Can I set up a rotation for myself? And the answer to that is yes and no. First, a preceptor has to meet the qualifications of SCO in our department, assuming that they're vetted and acceptable, and we have a geographical need for a site, and it is not a conflict of interest for that student to rotate there, then yes, we can proceed along the way. But when the time comes, simply because a student brought that site to my attention, that student will also compete, quote unquote, with every student from North Carolina for the opportunity to rotate there. So bringing a site to me doesn't necessarily mean that you will rotate at that site. It very well may mean that you can, but I just want everybody to understand that. And there's a lot of time and expense and legwork that needs to be gone into setting up each site. So just sort of understand that as well. It's not just, I'm not going to throw you to the wolves out there. I'm going to make sure, again, that any place any of our students go are offering you the best experience that you can get as a fourth year clinician.
Alrighty. Well, thank you so much. I don't see any other questions. So with that, I think we'll go ahead and bring us to the end of the webinar. We've covered some really excellent information today, and so I hope this webinar has been of assistance to all of you as you start on your optometric journey. Our next webinar will be our official May webinar, which will take place later this month, where I will go with you over life in the Mojo City, what it means to live and work in Memphis, all the incredible things you can do in the city, where our students live, how they live, and how they really enjoy being a member of this fantastic community. The date and time for that webinar will be shared tomorrow when we send out an email invitation. If you haven't done so already, please, I invite you to request more information by signing up for our inquiry form. You'll receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you so much, Dr. Mingel, for sharing of your time and experiences and being available to continue to speak with our students. And a special thank you to all of our attendees who have joined us. We hope to see you all at the next webinar in just a few weeks. But in the meantime, have a great rest of your week, a great weekend, and take care.